If you want fewer headaches, less neck pain, and to have less arthritis in the future, then pay close attention to this video. We'll outline why the curve in your neck is important to your longevity, what an ideal curve is, why most people lose their curve, and how to improve it. So check out the timestamps below if you want to jump to a particular topic. To capture the importance of the alignment of your neck, follow me on this analogy. Imagine the tires in your car being misaligned. Does this compromise how efficient your car is? Does it cause the tires to wear out more quickly? Absolutely. The same concept applies to the alignment of the bones in your neck. If the bones in your neck are not properly aligned, research has shown you're much more likely to have more severe disc complications, an expedited rate of arthritis, more headaches, and more neck pain. While this analogy captures a similarity between the alignment of our bones and the tires in our car, the implications of not being proactive are vastly different. If we leave our car's tires misaligned and the tires wear out, we can always get a new set of tires. If we wait for our neck to severely degenerate, we cannot swap out for a new one. In this situation, people are often left to decide if they want to opt for a risky surgery that could make things even worse, take painkiller medications which can have very bad side effects, or to endure the pain as it is. The sooner you take action with improving your neck alignment, the better. What is an ideal cervical alignment? There should be a C-shaped curve in your neck that points the same direction as your nose points. This is called cervical lordosis. When the curve goes the opposite way and points backwards, it's called a kyphosis. Please note that in your mid-back, you should have a kyphosis. So kyphosis is not always bad, but in your neck, it is. The ideal cervical lordosis is 20 to 42 degrees based on the posterior tangent method. Most people do not have this ideal curve in their neck. This is one of many reasons why it's beneficial to have x-rays taken so you know if your neck is lined up to last you for a long time, or if it's misaligned and probably going to degenerate quicker than necessary. Why people tend to have a reduced cervical lordosis. 1. Poor posture. Very few people have great posture. The worse the posture, the more likely you are to have a compromised curve. Number 2, trauma, such as a car accident and intense whiplash, can cause the ligaments to lose their proper tension, leading to improper alignment of the bones. And lastly, weak and imbalanced muscles. Chronic stress, improper exercise training, a lack of exercise, and various neurological conditions can all contribute to weak or imbalanced muscles. How to improve cervical lordosis. This is not an easy thing to do, so do not rely on any one treatment or stretch to get the job done. The muscles, tendons, ligaments, and neurology have all been configured to keep your head and neck the way that it is, probably for years, if not decades. A holistic approach works best, and research has shown that a multifaceted approach can lead to significant improvements in your neck curve. Number 1, see a chiropractor. Mobilizing the joints will allow for a neck that's more receptive to change. Getting x-rays and proper management are all very important things you can get from a great chiropractor. See a physical therapist. Having them assess which muscles need to be loosened, stretched, or strengthened can give you a customized approach to retraining your muscles to hold your neck in better alignment. Posture training. Again, very few people have great posture. We made a previous video on how to improve your posture, so we're going to reference that with a link in the description. And I really want to emphasize using the posture corrector device. It's unrealistic for anyone to be cognizant of their posture 24/7. Having one of these devices on makes it so that anytime you start to slip and round forward, it reminds you to keep that vertical great posture. Now for our general cervical curve rehab protocol. First off, pull downs. This is holding a stick or a golf club over your head, standing very tall, keeping your hips underneath you, and you want to bring that stick behind your head and press up again. This helps to retrain the shoulder and the neck muscles for better posture. You're going to do this 3 sets of 10 repetitions a day. Next up, we have chin tucks. This is just bringing your chin backwards and then let it come normal, and then squeezing that chin back towards your throat. You want to do this for 1 minute, 3 times a day. Now for the passive and active use of a curve restoring device. You can use a towel or a curve corrector device, which you can get on Amazon. We will have a link in the description below. This is placed underneath the neck or the upper back while lying on your back. Be sure to have your chiropractor know where exactly to focus the fulcrum of this device based on your x-rays. Day 1, you're going to lie and rest over it for 1 minute. And you're gonna add 1 minute per day up till day 5. This is just completely passive, relaxing over it. Day 6 and onward, we begin the active usage of the device. This is where you're doing a chin tuck, so you're actively pressing your head and neck against the device to retrain the muscles to function with the proper alignment. You're gonna do this 1 minute, 5 times, in addition to the 5 minutes that you've already been doing of resting the head passively over the device. Also ask your chiropractor about using an advanced curve correction tool like the one we have shown here. Follow through the recommendations in this video and the personalized recommendations from your chiropractor, and you can expect improvements in the alignment of your neck. And just like getting the tires in your car aligned, your longevity will be extended. Thank you for watching this video. Check the links in the description below to continue educating yourself on leading a healthy and pain-free lifestyle. We'll see you in the next video.